Dr. Vin Gupta is here. He's a critical care pulmonologist and faculty member at the Institute for Health Metrics and Evaluation at the University of Washington to help us sift through some of the science potentially behind this decision. Dr. Gupta, give it to us straight. Should people keep wearing masks on public transportation?
Eamon, good evening. Yes, they should. Right now, Eamon, this toolkit that we talk about, vaccines, therapeutics, it isn't where it needs to be quite yet. We still have under 5 without access to vaccines. I suspect that's going to change hopefully sometime in the month of May, early June with Moderna's application. That's promising. They already have it in front of the FDA. So that's good news. That's going to be one key piece. The other will we have more funding for therapeutics? That's being held up right now. Demand is far greater than supply. Once we rectify that, everybody will have that critical access to this toolkit. And Eamon, that will then allow us to revisit this discussion about masking and when to end the mandate in airplanes. It's probably going to end up happening anyway, sometime in May or early June, once this toolkit was robust enough. But we're not there yet. We're definitely not there yet. So still, if you're watching this right now, especially if you're medically high risk, really important to wear a high quality mask when you're in transit.
There's obviously, Dr. Gupta, and let's be honest here, a little bit of confusion about the trajectory of masks from the very beginning of the pandemic. The mask guidance from the CDC has been somewhat confusing. They lifted indoor mask guidelines, then they brought them back, then they changed the criteria, and then they lifted them again. What would you say to someone out there who thinks they no longer need to wear a mask indoors, certainly in a place that is as enclosed and cramped as a public bus or perhaps a plane?
Well, I would say we are entering a phase that's different from 2021 and 2020 when that confusion was rampant. So that to that individual, we should take advantage, Eamon, of this moment in time where people understand their medical risk more than they ever have, say, prior to the onset of the pandemic in December 2019. Can they categorize that either based on age or on their underlying conditions? If they consider themselves low to medium risk, I can't reasonably tell that individual that, yes, they must wear a mask at all times in public places. In an airplane cabin, it's important because we aren't checking vaccine status. And there's still a lot of critical unknowns here. We don't know, for example, what does a booster do, that third shot or that fourth shot in those that are higher risk? How long is that protection accorded? We're still trying to figure that out. We had some initial guidance on that fourth shot from CDC earlier this month. But again, there's some uncertainty there. Again, we have pediatric groups that still don't have access. Because of that uncertainty, certain places still need to have these mandates. But at an individual level, can I tell somebody who's otherwise healthy, consider themselves low risk medically, that they need to wear their mask in a grocery store if they're otherwise healthy, low risk? No, they don't, because that's where individual assessment really takes root.
So you bring up a really good point, and when you take a step back and look at the totality of what is happening and the trends of what we're seeing, you have cases that are slightly ticking up again on the coasts. Just about in time for the immunity from Omicron to subside. There's some warnings that there could be another variant that is starting to gain a little bit of traction. What should we expect as we head into this spring and summer? Because the flip side to that is spring and summer is when we would normally think cases go down, you're outdoors more, the weather's a little bit warmer, you're not in these enclosed places all the time.
Well, I think a critical factor here is the University of Washington estimates that we are only capturing 15% of cases in the recorded tally. So 85% of cases are currently going undetected or unreported because people are testing at home, as an example. The next 6 months, significant reprieve in terms of hospital stress. Until, say, Halloween, expect that hospitals in most zip codes across the country will not be experiencing ICU level stress from COVID. Eamon, that's going to change come November and as we get into the winter months. Remember, COVID and other respiratory viruses, these are seasonal viruses where transmission increases in colder, drier air. So I am worried about Thanksgiving time into, say, next February of 23, where we're going to have a resurgence. Critically, I see this clinically, 65 and older, only 1/3 to about 40% of those individuals had actually got a third shot. That third shot's vital to keep them out of the hospital. These dynamics are going to really rear their heads, and I worry a significant way come November, especially if we don't have these therapeutics. And one last thing just to keep in mind, there is this new oral a new pill in development, a new treatment that is under FDA consideration that might actually save people's lives once they're in the ICU. So if we have this broader toolkit with these new therapeutics, that could hopefully help mitigate the risk of a surge down the road, but lots of dynamics at play.